Good day, viewers and listeners. On today's COVID-19 update, Minister of Health Dr. Frank Anthony says the country's COVID-19 fighting capacity will be boosted with a donation from the government of Japan.
Through UNOPS, we have received a grant with Japan. It's about $1,029,000 US. And that grant was used to buy various needed equipment for the health sector that would assist us with COVID. So some of the things that we'll be getting through that grant include imaging equipment, ultrasound, that we can use to help with the diagnosis of COVID. We're getting at least 4 different ultrasound machines. We are also getting some sterilizers, ECG machines. We'll get some pulse oximeters and so forth. In addition to that, we are also, through this grant, we'll be getting 4 new ambulances, and most of these things are going to be delivered by the end of this month. Between this month and maybe November, we should be able to get all of the different items. But this has been a grant that we've been working on maybe for the past 6 months or so, and we are happy now that the items would finally be coming in together.
Minister Anthony says while more can be done, the country's COVID-19 immunization campaign has been progressing well.
The overall numbers as of yesterday, we have 354,676 persons who would have received a first dose COVID-19 vaccine. That's 69.1% of the adult population. We also had 184,072 persons who got their second dose. That's 35.9% of our adult population. And we have 22,634 children receiving their Pfizer vaccine. So that takes us up to about 31% of the person within this age cohort.
Minister Anthony also provided a regional breakdown of the numbers.
In terms of the regions, Region 4, they have been doing relatively well on both the first and second dose. So in Region 4, first dose, we have 77.3% of the adult population would have received a first dose vaccine. Region 1 is at 75.9%. Region 9 at 71.3%. Region 6 at 70.7%. Region 7 at 68.6%. Region 5 at 67.6%, Region 3 at 65.5%, Region 2 at 56.7%, and Region 8 at 43.5%, with Region 10 being at 28.9%. So these are first dose vaccination. In terms of second dose, Region 4 is at 40.8%, Region 1 at 33.8%, Region 9 at 38.1%, Region 6 at 36.2%, Region 7 at 32.9%, Region 5 at 37.1%, Region 3 at 32%, Region 2 at 32.7%, Region 8 at 28.8%, and Region 10 at 12.6%. So again, what you can observe from these numbers is that there are lots of people who took their first dose, but they haven't returned as yet for their second dose. And we want to encourage those persons to come out. So it's not just the Sputnik second dose that they're waiting on. There are lots of people who took AstraZeneca and the Sinopharm vaccine, but they haven't come back for their second dose. We want to really encourage them to do so.
Even as the country's immunization campaign progresses, the minister urged persons to take more precautions as the number of infections and hospitalizations increase.
If people start taking more precautions, I think we'll see a decrease in the numbers. And those precautions are very standard things that we're all acquainted with. People need to start wearing their masks properly. Too many persons are not wearing their masks properly. They either have them under their chin or don't wear them at all. That's not going to protect you. And therefore, mask wearing is a very important way of preventing yourself from getting COVID. We also have to get people to start, staying away from crowds, not being in crowded areas, trying to minimize how many people they are with in an indoor space, especially those unventilated spaces. So this is something that we got to get people to adopt a different attitude. And unless they do that, unfortunately, we are going to see more cases. So the three things that we keep talking about is wear your mask, wash your hands, and watch your distance. These are the three things that we keep repeating to people. Unfortunately, many persons still not abiding by these rules. In addition to these three things, we want people to get vaccinated because we know that if you're vaccinated, you'll have a reduced risk of getting infected, and it also reduces your risk of getting the more severe form of the disease. There are many different types of allergies. Some people would have food allergies, some people will have allergies to specific medicines. But in the case of COVID-19, what is more important is if you have an allergy to a component that is in one of the vaccines. So if you're going to get, let's say, an AstraZeneca vaccine, the main thing is to understand whether with a previous vaccination, whether you would have had an allergic reaction. And if you did have an allergic reaction to a vaccine, then that should be reported because that's important. Some people with the mRNA vaccine, they have an allergy to specific components of the vaccine. And again, if in your past medical history you've had an allergic reaction to these types of vaccines or the components within these vaccines, then you should let that person know. Outside of that, it's quite safe for you to go take the vaccine.
That's it for our COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.